Quality standards for various roles of administration. So quality standards for staff qualification and education. What quality standards you should follow when you're hiring new staff for a particular job description. So the first thing is you have to plan about what education, what skills, what knowledge, and what are the other requirements that a job profile calls for in an employee. According to that, you have to recruit the employees. Next is determining the medical staff's membership. Are they registered under the medical council or under the state council, and are the nurses whom you are hiring, they registered nurses to the towards the state council and um, national nursing councils. Also the pharmacists, do they have the license to run the pharmacy, etc. And the assignment of medical staff and the clinical privileges. Certain medical staffs have the clinical privileges, like prescribing drugs, only the doctors can do that. That clinical privilege is not given to the nurses, so you have to assign properly who has what privilege, and no one should cross the boundaries of their clinical privileges. Ongoing monitoring and evaluation of the staff member. Regularly, you have to monitor and evaluate your staff members based on their job performance. Are they up to date to their knowledge? Are their skills up to date? Are they technologically advanced enough? Medical staff reappointment and renewal of clinical privileges. For example, the staff nurses you have, their registration is near to expire. It's a responsibility of the hospital to renew the nurses registration who are permanent employees under your institution. So that is the renewal of clinical privileges. Reappointment means you are reappointing an existing staff nurse as a ward in charge. Those things has to be taken care of. And in nursing staff case, you have to check, have they finished their bachelor's in nursing education. If they have finished, have they completed their registration? Is the registration renewal date coming up, when each nurse's registration has to be renewed, etc. Those records has to be maintained. And other healthcare practitioners also, for example pharmacists, laboratory technicians, everyone, wherever registration has to be renewed or license has to be upgraded, thus such technical things has to be taken care by the administration. Next is quality standards for medical records. So you have to use a unique identifier for patient. No two patients will have the same identifier. Identifier can be either numerical, either any alphabetical or alphanumerical pattern. It depends upon the organization what they choose. It should be specific in terms of content, format, location of entries for patient medical records. For example, inpatient medical records should be kept separate than the outpatient. Outpatient should be on the outer zone of the medical records department, whereas inpatient medical records should be kept a little bit inside, and medical legal records should be kept separate from the other patient records. Adequate information to identify the patient, support diagnosis, and justify the care and treatment. Such important details, such nitty-gritties of the clinical care given should be completed. The discharge summary should be completed. No space should be left without the signature and the registration stamp of the doctor concerned here. Exact time of arrival, exact time of departure, what are the doctor's conclusions, doctor's summary, follow-up care, what they have to continue at their home. The copy of that follow-up care also should be placed in the individual's medical records. Quality standards for electronic medical records. So what happens here is the proper use of copy paste should be complied by. Wherever possible, reduce the chances of copy paste if you are using an electronic medical records, so that the staff has to comply with typing in each and every individual's case separately and not copy pasting the case summary from other patients, which will lead to future problems. And educate that and training the staff regularly. If you are implementing a electronic medical records, it may take months in training the staff how to use it. From the medical staff to from the clinical staff to the non-clinical staff, the training may move up to months. Monitor the compliance with the use of copy paste guidelines. Same, the copy paste guidelines should be kept in mind. Make sure the software should be intact enough that copy paste is not allowed. As much reduce the use of copy paste as much as possible. Ensure the accuracy of EMR. Make sure the information which you are putting in the electronic medical records is accurate. It is valid. If the time of arrival of a patient is 9 a.m., it has to be 9 a.m. even in the medical record. It cannot move up and down apart from that time. Assess the patient's AMR content and completeness on a regular basis. Quarterly or monthly auditing of the EMR should be done. Reviews are done quarterly by physicians, nurses, and other authorized parties to make entries. They themselves can review the EMR at least quarterly. Reviews will focus on timeline, legibility, and completeness of the EMR. If the EMR is not complete, automatically it will not be saved. It will give a sound, or it can make a noise of being incomplete, or it can be marked in red, so that um, the authorized people who are supposed to make entries, they can understand that which this part of a medical record is incomplete, and thus proper care can be taken up. Quality standards for human research. Hospital leadership is accountable for human research subjects, um, complies with all the regulations and professional requirements, and provides adequate resources. Everything should be transparent when you're taking consent for the human subjects to participate in a research. Hospital leadership establishes the scope of research program, requirements of sponsors of research, and conduct ethical research. We have to check what are the scope of the research which we are doing, which all areas it will be coming under this research. If there are sponsors for your research program, what are the sponsors requirement? Is the research requirement and sponsors requirement integrated, so that it will not create bias at the end? Conduct ethical research before commencing any. Ethical committee has to give a green flag for the research to be continued after you submit your objective and your research problem and the tool of method of data collection, everything. When you submit to the research committee, if they find the research fit to be carried out, they will approve it. Otherwise, you have to reassess your research topic. Accountabilities of outside contract research organizations are clearly defined. If you're conducting a research on a contract basis and an outside research organization is funding your research, they should be accountable for the results of the research, so that they will not be misusing the research for their personal benefit. Create contracts. These contracts will enable informed consent. Identify and manage conflict of interest with the research conducted at the hospital. The researcher should not be at conflict of interest with his or her own research topic. Integrate human subject research program into the quality and patient safety program of the hospital. Whatever patient safety program you have in your hospital, research program also should be an extension of that safety program. Informed consent process should be carried out at every level. Access to the clinical research for the patients and family should be given. If at all, for example, in a cancer treatment facility, if a treatment on a drug, a research on a drug is going on, and the patient who is in a stage 4 cancer has exhausted all the treatment available, the only thing remaining is to try out the new drug which is under research. Such information should be provided to the patients and their family, that there is a drug which is being researched upon. If they want, if they consent, they can participate. So such information has to be given out.